Okay, and now everyone's joining us.
Hello, everyone. I'm just going to give everyone just a minute or so here to get their audio connected and get fully logged in. So go ahead and just keep an eye on that as people come on board here before we start talking today. Good. Looks like people are still coming in here. So we'll just give it just another moment. Good. Okay. Well, looks like most people have made their way in. So I will go ahead and get started with introductions and introduce the topic that we're talking about today. So you are here for a webinar called Everything You Need to Know About LSVT BIG and LSVT LOUD, which is a guide for people with Parkinson's and those who support them. So my name is Jenny Tecito, and I am a physical therapist, and I have been an instructor with LSVT Global since 2011. I came on board full-time with LSVT just in December of this last year, and am currently the Director of Communications and Innovation for LSVT Global. I left behind a 20-plus year neurological physical therapist career of hands-on therapy prior to that. So I have a big background in neurological diagnoses and kind of in a new fun role here. So Beth, do you want to introduce yourself briefly too?
Yes, welcome. Thanks everybody for joining us. My name is Beth Peterson, and I'm a speech language pathologist, and I'm one of the LSVT LOUD faculty instructors. And my journey with LSVT Global began in 2009 when I, just out of grad school, started as a research associate on the LSVT LOUD clinical research team, and then became an LSVT LOUD faculty instructor in 2012. And really, once I saw the impact of the treatment firsthand, I just stuck with it, and I've never looked back. So I've been with LSVT Global since then, and currently my main role is to manage the webinars like this one today. We have webinars throughout the year that we host for both the public and also LSVT LOUD and LSVT BIG certified clinicians. So thanks for spending part of your day here with us today.
Wonderful. Thank you, Beth. And on the next slide, if you want to read even more details about us, our little biography about each one of us is here, which we summarized the important points for you already. So what we're going to also talk about today is just our mandatory disclosures that both Beth and I have a financial and non-financial relationship with LSVT Global. That includes a preference for LSVT LOUD and LSVT BIG as treatment techniques. And both Beth and I are employees of LSVT Global. Logistics today, as you guys all entered, your microphones should be muted already, and that helps prevent any background noise from coming in while Beth and I are lecturing. So we'll keep microphones muted until the end. If there's opportunity, there will be opportunity, I should say, to ask questions later on. So at that point, at the end, if you want to ask questions, we will allow unmuting of microphones to do that. We also have the option at any time to enter a question you might have in the chat function. So for those of you familiar with Zoom, you probably know what that is already. For those of you less familiar, there's a little button called chat. You can open that and at any time enter questions along the way. We are going to hold questions until the end, but feel free to enter them as you think of them. Also, there is the handout for this presentation, which has been uploaded into that chat already by Beth. And I was just thinking, Beth, I think sometimes in the chat, it's not visible to everyone until they're actually logged in. So if anyone's having trouble seeing that, now that everyone's here, Beth could load that in again just to make sure that everyone has access. At the end of the presentation today, we will have a survey that we'll launch, and we will also duplicate that with sending an email out to everyone who attended as well. So we love your feedback. We love to know what you'd like to hear from us next. And if any of you are physical, occupational, or speech therapy professionals, this is available for self-reported CEUs. And on this next slide here, you'll see the details on the things to maintain or keep if you want to report for self-reported CEU activities. So keep a hold of that handout. You will also get a certificate of completion, which will be emailed out to you within a couple weeks after the webinar. And know that you need to be in attendance for the full hour to earn that certificate. So first of all, we would really like to know a little bit about all of you. So we are going to launch a poll. And in this poll, we would like to know who you are. Are you a person with Parkinson's, a family member, friend, or care partner? Are you a therapist, and what kind of therapist? Or maybe you fall into an other category. So Beth here just launched a poll for us. If you can go ahead and click and answer for us which one you are, it helps us to know a little bit about all of you. We'll give you just about 30 seconds to enter the information here. Good, looks like we have a few more still. So far, it looks like leading the group is people living with Parkinson's disease. Coming up second is speech pathologists, and after that, physical and occupational therapists. And we have some others and some family members and friends. So it looks like we're being represented by all groups here. I'll give everyone about 5 more seconds here if you didn't get a chance, and then we'll share the results with everyone. Okay, let's go ahead and share the results. Good. So yeah, most dominantly people living with PD. We've got some therapists joining us. Nice. We've got a really good grouping of people that are here with us today. So thank you, Beth. Good. And we're going to move on then to our next slide to just talk a little bit about the learning objectives. And I won't read these in detail, but really what we're going to talk about today is I'm going to kick things off with talking about some of the motor and non-motor symptoms that affect Parkinson's disease and define different elements of the LSVT protocols that are used to treat that. We're going to transition then to looking at Beth talking more too about the importance of completing homework with LSVT BIG treatment and LSVT LOUD treatment. How to be a helpful caregiver at home and a care partner if you're in that role, and some tips to optimize your success while you're going through treatment or completing your home exercise program. So next, we're going to start with the breakdown of our tips for success. So really, we want to know and understand the key motor and non-motor symptoms that are common in Parkinson's disease. And if you're someone living it every day, you know these things well. But to kind of define and talk about some of those other non-motor things too that can be present. We'll talk about all about what LSVT LOUD and LSVT BIG are, talk about homework with doing those treatments. We'll talk about some general tips from LSVT clinicians and provide you with some resources for care partners. So understanding symptoms in Parkinson's, we really have symptoms that live on 2 different realms, and we in the medical world will refer to those things as motor disorders or non-motor disorder. So to define what the difference is between those two is the motor disorder is really the things you can physically see that are happening. An example might be your tremors, might be your softer voice, could be the smaller steps when you're walking. So the actual physical things that are noticeable by yourself and others. The non-motor side is more the underlying things that maybe are not so visible by others or even by yourself, that it's linked to this diagnosis of Parkinson's. So here, those common motor symptoms of Parkinson's would be that increased rigidity, tremors, bradykinesia, which is slow movements, and then hypokinesia, which is small movements. And that can affect both motor, like walking, talking, all of those aspects can be affected by bradykinesia and hypokinesia. Non-motor symptoms are the things, those kind of sneaky little things that lie under the surface, right? That might not be as physically alerting or out there for everyone to see. But many people with Parkinson's disease at some point in their diagnosis will deal with some depression. Typically later on in the diagnosis that we see the risk of that increasing. We also can see some changes of cognitive function. And for those of you less familiar with what cognitive function is it can be slower to think about things, where when you're in a busy environment and there's a lot of questions being asked or a lot of conversation happening, it's hard to keep up. And then by the time you think about what you want to say, the conversation has moved on and someone else has started talking and you just lose that opportunity to say something. So this can be more common as Parkinson's progresses. And a good thing to be aware of, as if you're someone living with Parkinson's and people are moving a little too fast for you with their conversation, it's a good thing to say, can you just slow down or repeat yourself, and allow them to know that you just need a little extra processing time to be able to have that conversation you want to have. Dementia can happen, doesn't always happen. It's 30% of the time. There can be also some other autonomic abnormalities, such as low blood pressure, bowel or bladder changes, vision changes. Some people will notice some tingling sensations, other sensory things. But the big piece that we want to talk about is that changes with kinesthetic awareness or kinesthetic learning. So that basically means your ability to know and sense what you're doing, and if you're doing it with the right amount of effort. So that's where we come in with LSVT BIG and LSVT LOUD, is when you're thinking, I'm talking loud enough, why can't people hear me? Well, your system's maybe not giving you that appropriate monitoring, where you're actually you're thinking you're talking loud enough, but people aren't hearing you. And the problem with that is, on the other side, the bolded item is that internal cueing system. So there's an impairment with that internal cueing system, where you're thinking, well, if I'm not talking loud enough, why don't I just fix it? Why don't I just talk louder? Well, it's this impaired system where you're not realizing you're not talking loud enough, so your body doesn't automatically try to fix it. So those couple pieces of those non-motor symptoms are something we're going to talk about quite a bit with LSVT treatments. And then here, the sensory disorder. So this whole piece that we talked about, the speech side of it, where when you're talking, you think you're talking loud enough, but people are still not hearing you. From those of you that have Parkinson's disease, how many times have you told someone else that they need a hearing aid? That it's not you. I see some hands go up. It's not me, that you need a hearing aid. If I had a quarter for every time I heard that, I'd be a wealthy woman. So it is that piece that you're not aware, and it's the disease, it's the diagnosis. You're not intentionally trying to do that. It's the diagnosis itself. And then if your therapist or someone says, can you speak louder? It feels to you like you're shouting. It doesn't feel normal to you. You feel like you're yelling at someone when you in fact are not. So working on this whole sensory side of it. When we apply that to movement then in the LSVT BIG side of things, you may think that you're standing with the right posture, that you're standing up tall, when in fact you may be leaning forward, you may be falling forward, and totally unaware that that posture piece is changing, until maybe you see yourself in a photo or on a video and you think, oh my gosh, look at my posture. So again, that sensory piece that the diagnosis brings. With walking, your walking you might think is normal as well. And then for some reason, everyone else is walking faster than you. And why am I not keeping up? Why is everyone walking so fast? And then when someone asks you to walk bigger or walk faster, it feels like you're running. So again, that's the sensory piece of having this diagnosis. And then next slide here, we're going to talk about that internal and external cueing for movements. So Parkinson's disease results in that disruption of that internal cue, that idea that if I am moving too small or I am talking too soft, why doesn't my body just fix it? Why doesn't it just automatically recognize it? So that's that internal cueing issue. Those deficits in that self-initiated movement are part of that supplementary motor area of your brain. And what we do know and what we've learned with research is that you don't have to accept the idea that my internal cue is broken and it can't be fixed. It can be helped. And through therapy, we can improve that and make that better. So people can get louder and they can move bigger and more normally with being cued to do so. But it's not easy. So knowing, I think the first step for people living with Parkinson's and people supporting and loving those that are living with Parkinson's is knowing that that deficit exists. So it's not that you're intentionally trying to move slower or intentionally trying to talk softer. It's my diagnosis. It is part of having Parkinson's disease. And as soon as you understand that and the people around you understand that, it helps make a more productive working relationship, where I can provide those kind reminders of, hey, mom, you're not talking loud enough. And that is a reminder to you to go, oh, I know, okay, I need to talk louder, and have that conversation with each other and have a productive relationship. So experiencing what it feels like to talk too loud or to move too big for your caregivers and your loved ones can kind of show them what it feels like to be you and to trust that I need to move loud, move bigger, and that I need to talk louder. So it helps understand that internal deficit and appreciate the effort that it takes to talk louder and to move bigger. All right, so on our next slide here, we're going to talk a little bit about what LSVT is. So some of you may be really familiar with what LSVT LOUD is and what LSVT BIG is. Others of you may be listening for the first time to learn. So how do they address these motor and non-motor symptoms that we talked about that affect voice and movement? Well, we're going to fill you in a little bit about what that is here on the next slide. So LSVT programs and protocols have been around for 30 years. We've had over 30 years of federally funded research and clinical experience that both of these treatments are based on. LSVT LOUD is speech therapy that is delivered by certified speech language pathologists who have been through LSVT LOUD training. And LSVT BIG is physical or occupational therapy for physical and occupational therapists to deliver that have also been certified in LSVT BIG. So one, you have to have a degree in one of these areas. And then two, you have to go through a certification course to be able to provide this treatment to people. What is a part of these LSVT programs? So what is it all about? Well, they are structured, evidence-based protocols that were developed specifically for Parkinson's disease, but they can be used for other conditions too. So examples might be other atypical versions of Parkinson's disease. We also have published literature on application to stroke. We're starting to have some publications on even application to pediatric diagnoses like cerebral palsy, Down syndrome. So there's been some expanding research in other areas, but it was initially developed for people with Parkinson's disease. We focus on the principles of motor learning and neuroplasticity. And you might be wondering, what does that mean? Well, our brains are moldable. Our brains are changeable. And I always like to reference the idea of professional athletes. So take a golfer like Tiger Woods. Most of us know who Tiger Woods is, right? Tiger Woods, if he wants to be better at hitting his driver, he is going to practice hitting that driver over and over and over again hundreds to thousands of times to hit from here to that specific spot so that he can get it right. Well, what we do for neuroplasticity with functional activities, with speech, with all of that is we're practicing exercises and actual functional tasks, saying specific terms in your language that you say frequently, and practicing those things over and over and over again so that your brain can adjust and realize that that's the amount of effort that I need to use when I want to be heard and when I want to move like I used to move, when I want to be back to my normal movement patterns that I had prior to Parkinson's. So this is what the LSVT LOUD treatment session looks like. And as a review, this is delivered by speech language pathologists. There are exercises that are done. So the first exercise is a sustained ah. And Beth, as a speech therapist, does this way better than I am, but I'll give you a little demo. So it's holding that ah, where it'd be like, ah. And people hold that over and over again for 15 repetitions and practice maintaining that breath support and that volume throughout. They'll practice highs and lows, which means they might start at ah or ah, so that we get that full range of going from high to low with our voice. You practice functional phrases, which might be saying good morning in your loud voice, something you often say every day. And then we practice hierarchical speech. So structured reading that builds complexity over the 4 weeks of treatment. So sustaining that loud voice over longer conversations, sentences, etc. This has homework assigned with it where you practice at home all 30 days of the month, and carryover assignments where you're using that loud voice in real life outside of the treatment session. So through that, we're rescaling amplitude by doing the exercises, and then we are bringing the treatment amplitude to function through using that functional conversation skills that you need in everyday life. So we talk about calibration in LSVT treatments. What we mean by calibration is that our goal is to take you from having that soft voice that people can't hear to being able to speak with a voice that people can hear no matter where you are, and for you to learn and accept that that is the amount of effort that it takes to talk with that voice that allows people to hear me, and that you automatically default again to using that volume with your voice. So it addresses that mismatch between what your perception is of vocal loudness and how others perceive it. The way I like to say that too is if you have your thermostat in your home set to 70 degrees, but your thermostat is always reading at, it's keeping the house at 65, your thermostat is out of calibration, right? You've set it for 70, but you're only getting 65. So that's kind of what happens with voice and movement is I've set myself up to speak like this, but for some reason it's coming out softer. So what we want to do is we want that thermostat set to 70 degrees, and we want the house to truly be at 70 degrees. And that would mean that we're recalibrated, that the system is calibrated again. So we'll talk about that again with movement here shortly. And then the goal of LSVT LOUD is using all of those exercises, all of those treatment techniques that you've gone through, and to be able to use that louder voice every day in conversation, at home, in your community, on the phone, no matter where you are. So then the LSVT BIG treatment session is based on LSVT LOUD. So we kind of formed that whole idea that you have the same maximal daily exercises, but your body moves in a lot more directions than your voice necessarily does. So instead of just 3 exercises, there's actually 7. And the reason there are that many is to incorporate all the different directions we might move in. So the first 2 exercises are done in sitting. The 5 after that are done in standing. And we practice them repetitively with good posture, big steps, big hands, to really try to bring that amplitude to movement in everyday life. We practice walking with bigger effort, so longer strides, bigger steps, bigger arm swings, good posture. We practice functional component tasks. What that is a simple task that you might do every day, like standing up out of a chair, or pulling your keys out of your pocket, or dialing someone's phone number on your phone. And we practice using big amplitude to do those things. We have that same kind of hierarchy practice like speech does, where they practice reading and longer tasks. But for us, that might look like the process of getting in and out of the car, or taking a shower, or getting dressed, or maybe playing a game of golf, if that's something you do on a very regular basis. So finding those multi-step complex activities that you do on a regular basis and bringing amplitude to those as well. And just like with the loud treatment, you're going to have homework. So there's homework that's assigned. And if I can just say one thing about homework across both treatments, is you will get out of this program what you put into it. So doing your homework on your own, practicing, implementing the things that you do in therapy, outside of therapy, will make your success with this program so much greater, will make those improvements so much greater that it's worth it. It's worth the commitment to get those things done. So we use that LSVT BIG treatment, the exercises as building blocks to help carry over to good large amplitude movements with your day-to-day functional tasks. So we like to say that it's all about function. We use the exercises to teach you how to be functional with your speech and with your movement. And then in LSVT BIG, calibration, again, addresses that same mismatch, but between your perception of your movement and how others perceive it. And we also see where when I ask people to walk bigger, they think they're walking far too big, far too dramatic. Like, people are going to look at me like I'm crazy if I walk like this. And that's sometimes where we like to use that video footage to take a look at, does that in fact look crazy? Or does that actually look pretty normal? And we might ask loved ones to give some feedback on that. Like, how does it look when he walks that way? Does that look like he always walked before? Now we're getting closer to getting that movement pattern back in place. And our goal with LSVT BIG then is you're taking what you've learned with the exercises and you are applying that to everyday life. So your rock and reach exercise is similar to that big reach overhead that you might need if you're reaching for a book on a shelf, reaching up high in a closet, and anything like that. So we like to talk about this idea of a lifelong model of care where we are seeing you for therapy sessions for LSVT LOUD or LSVT BIG. Those treatment sessions are 16 visits in 1 month time. So we see you 4 days a week for 4 weeks. 60 minutes one-on-one therapy. Our entire focus is on you the whole time and meeting your goals, working on the things you want to improve. You're doing your own daily self-practice at home, so you're working on that homework. We're going to talk later, and Beth's going to talk about group practice options too, which we have some training for therapists to start classes called Loud for Life and Big for Life for graduates of people that have already done the LSVT one-on-one therapy. And then we also recommend scheduled tune-ups, every 3 to 12 months. So we want you to think about your relationship with your therapist as a lifelong relationship with a diagnosis that you're going to have, that you're going to learn to live well with. And every so often, we're going to need those checkups to make sure that you are staying at the top of your game and work on the things that might now be difficult that weren't difficult before, and work on recalibrating things that might need recalibrating. So we'll talk a little more about that later as well. So at this point, I'm going to turn it over to my colleague, Beth, and she's going to pick up to talking more about how can care partners be helpful with this process.
Great. Thank you, Jenny. And thank you for that really helpful overview of those motor and non-motor symptoms, and then that great overview of the treatment approaches. And we'll shift a little bit now and talk about how care partners and loved ones can help during and after both LSVT LOUD and LSVT BIG. So as Jenny mentioned, and I love the way she phrased it, you get out what you put in, and that home routine really is critical, a really critical element of success. So yes, we'll do the exercises with you in the treatment room, but if that's all you did and then you didn't do your homework at home, we can't expect you to have the same results that we've seen in our patients and in the research that's been done. So I'll just briefly go over the homework so that you know what that looks like, and then also how care partners can help with that. So for LSVT LOUD, during the month of treatment, clients will have 5 to 10 minutes of homework on one other time when they have treatment. So they'll have treatment and then they'll have a homework session sometime that day. On days when they don't have treatment, you might see your therapist Monday, Tuesday, Wednesday, Thursday. On Friday, Saturday, Sunday, you would have homework twice a day on those non-treatment days. Those ones are a little bit longer, 15 to 20 minutes. We just give you some extra reading practice there. With LSVT BIG, it's a similar setup. So homework one other time on days that you see your therapist for treatment, and days that you don't see them, you'll have homework 2 other times that day. So that's what treatment looks like. You'll have homework all 30 days of the month. As you can see, you have it when you see your therapist and also the days that you're off in between. And what does homework look like? And I like to think of it as a mini treatment session that you're doing at home. So you're doing the same daily exercises in LSVT LOUD, but instead of 15 repetitions, you're doing 6 repetitions. And when you're reading your functional phrases, you'll just do that one time instead of 5. For the hierarchical speech exercises, you'll just read for about 5 to 10 minutes, reading that your therapist provides to you. And then the carryover assignment is a really nice element of treatment that lets you use your new loud voice outside in your real world. And I love that part of treatment because it really allows clients to get a feel for what it's like to use this loud voice and how others respond to them. Because as Jenny mentioned, especially when you're just starting treatment, it might feel funny to speak loud. You might feel like you're shouting, but once you try it out in the real world, in the wild, and someone responds very positively, it can really help you see, okay, this feels too funny to me, but they responded in a great way. I'm going to keep going. So that's a big part of the homework that we assign every day of the month too. LSVT BIG is going to be similar. So again, a kind of a mini treatment session that you'll do at home. The daily exercises, so less repetitions of that. You'll do your functional component tasks again, and then you'll also have some big walking practice every single day for homework also. And just like with LSVT LOUD, you'll also have a carryover assignment. So this is when you'll use a bigger movement, again, that might feel funny to you, especially as you're starting treatment, but you'll use that bigger movement in a real life situation outside of the treatment room. Come back and tell your therapist what it was like for you, how others might have responded to you. So again, that's a really fun one for LSVT BIG too, to see what does this really do outside of treatment. And that's the end goal of therapy, is that not only can you do it with us in the treatment room, but that you're successful outside of treatment. So those carryover assignments are nice chances to see how this works, again, out in that real world. So how can care partners help with these daily homework assignments? So the first is just to help establish a good homework routine. And we like to do this right away. The first week of treatment, making sure we have a good homework routine so that clients will continue to practice the whole month of treatment and after treatment concludes. So this might include having a good time and a good place set up. So is there a time of day that works best for the client? Maybe first thing in the morning so they get warmed up. Maybe they want to do it in the evening. It's their last thing they do, or maybe it's in the afternoon. So whenever it might be that they can consistently fit it in, that's when we like to get it. We have a phrase that someone had said, you brush your teeth, you do your Oz. So it really becomes that much a part of a normal routine in your day. And then also helping establish a place to do homework. We get some clients who say, oh, I live in an apartment. I don't want to wake up my neighbors. They're going to think I'm crazy. So with that, we would remind patients that, you're actually just speaking in a normal loudness voice. So others aren't going to think you're crazy. If you feel more comfortable, you can go talk to your neighbor, say, I'm doing some voice lessons. If you hear me, that's what I'm doing. You might find a room in your house that's more central, so you're not by a wall if that is bothering you. But just making sure you have a good place that you can do your exercises every single day, whether it's for LSVT LOUD or LSVT BIG. Also help with the setup. So especially with LSVT BIG, if you need to get a chair to help with the exercises, or if there's any other components that you might need, getting that help set up before they begin their homework. If you have a homework helper video, or with LSVT LOUD, we also have a software program that can be set up. So just helping get that set up for your client, and then they can go ahead and do it independently with the assistance of that video or the LSVT coach. Sometimes it's just a matter of reminding your loved one to do their homework. They'll say, hey, your therapist told me that you have homework every day. When are we going to do it? Or did you do it today? So just checking in with them might just be a reminder that they need. And then again, helping to check in, make sure that they've done it. You can even, jot a note down on the homework form, say how that you might have helped with it. You can ask or observe what the patient did at therapy, and then just kind of be in tune with any progress or setbacks. We certainly have clients who some days they're doing great and other days they're not feeling as good. So just kind of being aware of, they can still do homework. They still need to move big and be loud, even on days when they don't feel their best. But it's nice to know, if they're not feeling quite as successful, this might be the reason. So just kind of being in tune to that, just as a therapist would as well. And then we have to cue or coach if appropriate or necessary. And when we train the clinicians in how to do LSVT Loud and LSVT Big, we talk about what would be appropriate cueing for loved ones and caregivers to help with. So with Loud, it's not that we want a caregiver to say, be loud all the time. And anytime their loved one is quieter, we don't want them to feel like they have to do it all day long. But rather, we would pick a time of day to cue or a length of utterance to cue. For example, if we know your client or your loved one can have a loud voice anytime they're speaking in a short phrase. So that would be appropriate to cue because we know they can be successful with that. They don't drop in volume very often, so you can cue when they do. So we would teach the loved one how to be a good kind of coach at home with those. You can also help set up some follow-up appointments or help find LSVT for life or big for life classes. So we'll talk about that as well. And as I mentioned, after treatment, so it doesn't mean that homework ends then. You'll continue to do homework every single day for the rest of your life. Just like Jenny gave that great example of an athlete working hard. If Tiger Woods stopped playing golf, then we can't expect him to be where he is with golf and continue to do that if he stops playing. Or if, for example, you were running and you were getting in good shape maybe for a marathon or a 10K or whatever it is, and then you stopped running, you can't expect to be in that good marathon or 10K shape. So just like with that, the LSVT Loud and LSVT Big exercises need to continue to be done every day to maintain those great gains you made with your therapist. And so care partners can really help making sure that after treatment, you're still doing your homework every single day. And we have some tools that can help with homework for those that might need it or want it. So there's the homework helper video that's available for download and streaming. And so this is just one of the therapists, Jenny, is featured for LSVT Big, walking you through the exercises. And we also have the same thing for LSVT Loud. So a care partner might be the one to set that up and get that going so that the client can focus on that for their homework session for the day. The LSVT Coach, again, is a software program that can be installed, and it also walks clients through it can actually do treatment sessions or homework sessions, but the clinician would just program, the goals, so how loud the patient should get, how long their ahs should be, and it walks them through a session as well and provides them feedback. So, that was great loudness, or be louder, or go longer. So those are some tools care partners can help get set up with for the client practicing their homework. There's also some exciting group exercise options after you've finished LSVT Loud or LSVT Big, called Loud for Life and Big for Life. And I have a couple slides on that I'll go over in just a minute. And Jenny also mentioned being on board or ready for tune-ups. And so we like to check in about every 3 to 12 months, just depending on disease severity, how you're doing, have you been able to maintain practice. And those tune-ups are just chances to come in, work with your therapist again. It wouldn't be a whole session normally. You wouldn't have all 16 sessions again, but just a few treatment sessions to get you back up to where you were at the end of therapy or even better. So we'll just do those tune-ups. So just kind of staying in touch with your therapist, making sure that those are occurring. And your therapist also should be the one touching base with you too. So as the care partner, just kind of being aware of that ongoing relationship and helping with that. And then also encouraging other enjoyable activities and fitness programs that are going on in the community. So these Loud for Life and Big for Life classes are also an option. Again, the patient would have to have finished LSVT LOUD or LSVT BIG, the full protocol first. But these are really nice options for group exercise maintenance. And it's led by an LSVT LOUD or LSVT BIG instructor. And they take patients through in a group setting the exercises of treatment and then have a fun activity using those bigger movements or the louder voice for the whole class. So they're really fun to do. Jenny and I both teach these classes and lead them. And it's just so fun to see the patients on a regular basis. So we usually do them once a week. And it's really nice to have others in the class and really get that good support and just motivation in general. So they're a really fun option for those that want to continue in a group setting. If you're interested in finding a Loud for Life or Big for Life class in your area, on our website, so on lsvtglobal.com, you can go to find LSVT clinicians. You can select if you're looking for LSVT Loud or LSVT Big, type in your location, and then when you click search, if they have this designation like you see on the screen here, Loud for Life provider, that means this clinician has gone through extra training to learn how to lead those classes. So if you're a speech pathologist or physical or occupational therapist in the audience, that's also an option for you if you'd like to take an extra course to go through that training so that you can also have this designation on your profile so that those in your area can look for you to lead those classes. Another exciting development is that we are looking to launch an LSVT for Life wellness living program. So this would be virtual Loud for Life and Big for Life classes. We're going to do a soft launch of this October 1st with a kind of a pilot group of clients that we've been working with to see how it goes. And so look for emails about that as we do that launch, as we get that going. And if you've completed the treatment protocols, we'd love to have you check out a class and see if you'd like to continue joining us. And those would be virtual ways to do Loud for Life or Big for Life. So next I'll talk about some tips that we've gotten from LSVT clinicians and then also some patient insights for those caregivers to hear about. So a big one was to focus on what the person with Parkinson's gets right, not wrong. So focus those comments that you're making on the positive. So I can hear you, or that voice sounds great. Now you're walking right next to me. So really keeping it positive and helping to keep it motivated. Also, you can help facilitate some interactions beyond the treatment sessions. So this might be a lot of times with Parkinson's, if the voice has dropped, then the person with Parkinson's has kind of given up phone responsibilities. They'll say, oh, I don't want to answer the phone. You know, they can't hear me. I don't want to make this phone call. It's always a struggle. And so maybe once they've gotten some success, you could say, hey, you know, let's call our niece today. We haven't talked to her in a while. Why don't you make the call? You can kind of help set up some of those experiences. We know with COVID, we're doing a lot more Zooming. So maybe that's even a Zoom in-person session. A Zoom virtual session. In-person get-togethers when possible, just thinking of ways that you can maybe help facilitate those interactions with others so they get a chance to use that new louder voice and new bigger movements. Some other tips are be empowering. So as the care partner, you might be used to caring and kind of taking over, and this comes from a place of love because you want to make sure that you're really supporting your loved one. In some cases, we want you to step back a little bit, and instead of jumping in and speaking first, or opening the door to a restaurant, it might be that you let your loved one with Parkinson's do that first. So give them a chance to do that. Let them feel that empowerment that they can do it, because that's a big part of what we're doing in treatment, is we're showing them this is an aspect of Parkinson's that you can take back. So you can get that louder voice back. You can get those bigger movements back. So they need opportunities to do that. So just thinking, okay, this is a good chance. I'm going to step back and let you try first and give you that empowerment to be successful. And also this kind of goes back to the other one, allowing your loved one to take on roles they might have stopped doing after Parkinson's. So answering those phone calls, maybe writing thank you notes. A lot of times the handwriting gets smaller, more difficult to read. That's something they can work on through LSVT BIG. So giving a chance to do that again. Helping with household chores that you may have taken over. So again, kind of thinking about opportunities that you can help facilitate and provide for them to take back some of that power that they may have given up after the diagnosis. And then with that, also kind of to stop doing everything for them, even if it could be more efficient or easier for you to do it, but having some patience and letting them do it and showing them that they can, And over time, they're going to get better with it too. Some other tips from clinicians. So thinking about how to be a good coach. So you can observe a therapy session or multiple sessions so you can see what's going on and understand the exercises. You can kind of learn the exercises yourself so that you can be a good coach. You might ask the clinician to lead a portion of the session, and that clinician can provide you a feedback on cueing. So we don't typically have loved ones or caregivers sit in multiple sessions with us because we want to make sure that we're going back to that empowerment, that the person with Parkinson's is the one that's reaping the rewards of doing treatment, and they're the one that's focusing on the treatment. They can do it themselves. We want them to feel that independence. But sometimes we will bring in a loved one, again, just to observe a little bit, give some feedback to them, educate them a little bit, but it wouldn't be for all of the sessions or even probably not even a full session. But we would have you come in or observe so that you can see what we're doing and how you can help at home. Making sure that you're using simple phrases when you're coaching at home. So if you want your loved one to speak louder, just like in treatment, we focus on just think loud. We don't tell them, sit up straight, take a deep breath, good posture, open your mouth. We just give them one cue, and that's to think loud. So we would ask the same thing for you. Just keep those simple phrases at home and you'll get great results that way. So think loud or move big. So keeping it simple. And another tip that we do in therapy is to show or model what to do instead of over explaining. So the same thing, you don't have to tell them a bunch of things to change in order to be understood, but you can say, let's be loud, and then you can even model louder, or walk like me, and you can have a bigger arm swing instead of over explaining what you want your loved one to do. I mentioned this before, but just helping to plan that exercise time. You can even try to do it when the medication is working its best. That might be a good time to do it. They're feeling their best. They're feeling really on the medications. And so that might be a time to plan when to do the homework at home. One thing I like to do, and I'll tell clinicians this in the training, is that halfway through treatment, with the permission of the client, I like to call, a spouse or loved one, someone they talk to a lot, and I just get some insight into how it's going outside of treatment. I might say, have you noticed any changes in your loved one's voice and speech? What have you noticed? What % of the time are they able to be louder? Are they doing their homework? And so just things like that, if you're open to receiving a call from the therapist, that can be really helpful to just give some insight into how the patient's doing at home. And then the therapist can work with that throughout the rest of the treatment sessions to see if there's things that he or she needs to adjust. And the kind of big theme is having patients be empathetic. I know Jenny talked about those sensory deficits, which we might not all understand after getting a diagnosis. So it's helpful to understand, they're not trying to be too quiet, or they're not trying to walk so far behind me, but that's a result of Parkinson's. And so just having some empathy for, if they're moving bigger or keeping up with me, it feels funny. Or if they're talking louder, they feel like they're shouting, and just how difficult that can be. And so just having some empathy for those deficits, and then just having some patience with them also. Some other communication tips specifically from LSVT LOUD clinicians would be to really just kind of optimize communication environments for success. So it might be that if you're walking into a room, you're speaking face to face instead of having one face the other and the other's on the other side of the room, and your voices are projecting different ways. We know that can cause frustration even for those without issues with keeping the volume up. So making sure you're speaking face to face, having that good eye contact, turning down background noise. So if the TV's on or someone's on their phone, just minimizing those distractions. If you're in a restaurant or more of a social situation, try to look for a quieter seating area so that you don't have a lot of other background noise around you too. So just some general tips to keep in mind to help optimize the communication environment. And these are some great insights from people with Parkinson's that have been going through the treatment. So these are some quotes. It's hard and frustrating, be patient. Encouragement, that's the best gift. And so these were all direct quotes from an informal survey of patients about their caregivers. Or so this one said, my wife is very knowledgeable and supportive. She adds new exercises to our ever-expanding mix. Rather than getting discouraged, she incorporates new lessons without complaint, making it easier for me to remain committed to my exercises. So again, just really having that support at home. Or encourage me to do it at home. do it with me, time me, give out encouraging words, so you can see how much it matters to have that encouragement at home, and having that support. So we also have some questions when you're looking for an LSVT Loud or LSVT Big clinician. So we have, as you saw before on our website, you can find a clinician in your area. And so when you find somebody that you want to connect with, the first question would be, are you currently accepting patients? If so, these are the big things that we want you to be asking about. Making sure that they deliver the gold standard dosage of LSVT Loud or LSVT Big. So that's 4 days a week for 4 weeks. They're individual sessions, and each session is an hour long, and it's daily homework and daily carryover assignments. If they're not doing the gold standard, then you can expect to have the same results that we've seen in the research studies and that we've seen from so many other clients who have gone through the program. So if they're not doing the gold standard dosage, then you don't want to be working with that clinician. Because you want to really, if you're going to put in this time and effort, you want to make sure that you can get the most bang for your buck, as I would say, so that you're really getting the most out of treatment. You can also ask how many clients that they've treated before, what are their typical outcomes? So how are they doing pre to post treatment? And then do you have a follow-up or maintenance plan for your clients? So we tell clinicians when we're training them that they want to stay in touch. So again, that's touching base every 3 to 12 months. Sometimes it's a simple phone call. How's your voice sounding? Are you still doing your homework routine? Great. Okay, I'll call you again in 6 months. Keep it up. Other times it's those tune-up sessions where we said that you might come in for a few sessions to just get you back to where you were at the end of treatment, tune you up in your bigger movements or louder voice. So seeing if they have a follow-up or maintenance plan for you so that they are staying in touch. And I mentioned this a little bit, but just really knowing that if LSVT treatment is anything other than that gold standard dosage, with the exercises, the homework, and the carryover that we've been talking about, it's not actually LSVT. So you wouldn't be getting LSVT Big or LSVT Loud. You would just be getting, speech or physical or occupational therapy, but it wouldn't be the protocol that's been heavily researched and used in the clinical setting. There's no modified versions, and we tell clinicians this in our trainings. They can't call it LSVT Loud or LSVT Big unless they're doing that dosage. You can't modify the protocol because that's what's been done, and that's what shows us those great results. And treatment fidelity is key. We want to make sure that clients who are receiving the treatment really are getting the treatment and can expect to see the changes that we've seen in the research. So if your clinician that you contact offers any modified version, we say don't do it. You should find another clinician because you won't reap those benefits of treatment that's been established in those 30 plus years of research. And how can you learn more about the treatment programs? So we have a blog. There's lots of nice research articles on there, lots more webinars. So we do these webinars throughout the year on various topics related to Parkinson's and other neurological disorders, and then also LSVT Loud and LSVT Big. So you can check out more live webinars like this. There's also the on-demand webinar library. We have some blog articles, videos, also some seminars that you can participate in. And then we also have kind of our main section of our website. There's a great patients and family section that gives you a lot more information about the treatment protocols. Same thing with that what is LSVT Big and what is LSVT Loud section. Follow us on social media. We have some great social media gurus who are constantly updating our social media channels, so tune into those as well. And then you can always email us. So anytime you think of a question, you want some guidance or feedback, feel free to email us and we can point you in the right direction or get in contact with you and help you with whatever question you might have. So that email's on your slide here, info@lsvtglobal.com. And the last part I want to touch on is just for the care partners in the audience, making sure that you are avoiding burnout. And so we have some suggestions and some resources here to help you with that. I talked about working with the clinician on when to cue so that you don't get burnt out at home feeling like you're always coaching or cueing your loved one. Also, just using those keywords when cueing. So think loud, think big, and that's all you have to think about too. So again, you're not burning out trying to do everything. You can also put up signs or reminders around your house. So I'll often have clients put up like a think loud sign, behind their spouse's head at the dinner table or by the phone where they make a lot of phone calls. So you can have other reminders around the house too. It doesn't just need to fall on you. Making sure that you're seeking respite care or finding other family members to help out with driving to appointments, setting up Zoom calls, whatever it may be. There's also support groups that are offered for both people with Parkinson's and their care partners. Making sure that you're taking time for self-care too, so that you can continue to be a good care partner. I won't go into detail for all of these, but I just want you to know that these links are in your handout. So these are some recommended resources. A lot of the Parkinson's associations and foundations have some nice sections on their website specifically for caregivers. So if you go to any one of these kind of main websites and you just typed in caregiver or care partner, you could find a specific link or be directed on their website to where you could find even more resources and more information. So we have a lot of those listed here, so definitely check those out too. So in summary, as Jenny mentioned, it's important to understand both those non-motor and sensory changes and internal cueing deficits that can help care partners better empathize with the difficulties that your loved one might be facing. Homework is such a critical part of treatment success, so making sure that clients are doing homework during the month of treatment and beyond. Care partners are playing such a helpful role at home to ensure that not only are patients making gains in treatment, but that those are going to be maintained and those follow-up recommendations are going to occur outside of treatment also. So the LSVT protocols you've seen are evidence-based, so they're based on over 30 years of research created specifically for those with Parkinson's. So help your loved ones improve communication and movement by ensuring that they're truly receiving LSVT LOUD and LSVT BIG by a certified clinician as it is prescribed in the protocol. So again, 4 days a week, 4 weeks, 1 hour sessions, individual therapy. And then lastly, those last few slides, we're just making sure that you know that it's also important to take care of yourself as a care partner. We know it's a rewarding role, but it can also be exhausting. So just making sure that you can get the resources that you need for yourself too, so you can continue to be a helpful caregiver. We have an exciting webinar video showing that we're going to be doing next month. This is a special showing of the film Spark, and this is Robin Williams and his battle with Lewy body dementia. And so this is a really neat opportunity we'll actually show the video together, and then we're going to have a 10 to 15 minute panel discussion after the show. So it should be a really great experience with some experts out there that can discuss Lewy body dementia, answer questions. It's a really neat showing that we'll do. For those in the audience that are healthcare providers, we'll have one more geared to healthcare providers on Tuesday. So that Tuesday evening, for those of you more of a community showing for those with Lewy body dementia or those who care for them or love them. That would be on Wednesday, October 26th. So you can find the links to register for those on our website at the link provided here. And we hope that you can join us for that. So we'll have a few minutes for questions here. Jenny and I can stay on for about 10 or 15 minutes if questions come through. So you can either type in the chat box on your control panel, and then we'll see that chat come through and we can answer your question out loud. You can also raise your hand and we can see you in your little box, and we can unmute your microphone so you can ask your question out loud to the group. If you have to run now or you think of a question later, you can always email us. And so that's info@lsvtglobal.com. And just a big thank you. So we're so glad that you're here with us. Thank you for joining us for this hour. If you do need to sign off, we are at the top of the hour here, so you can sign off. If you want to stay on for questions, feel free to stay on for questions. As I mentioned, we'll stay on for about 10 or 15 minutes. We do ask you to take the survey. It should be quick. It should take 5 minutes or less, and it will pop up as soon as the webinar is over. It will also be emailed to you. The email should come through tomorrow, and so you'll also have a chance to take the survey and that email. So we just want to say thank you for joining us. It's been a pleasure to have you here for this past hour, and we'll stay on and answer some questions. So let me stop the screen share so that I can see more faces here. All right. And Jenny, I don't know if any questions came through during, okay.
We don't actually have any questions in the chat right now, but it does look like, Hetty, are you raising your hand there? You can go ahead and unmute.
Oh, I don't.
Maybe not. Or I can also click ask to unmute. So I will see. If it's not working. Okay. Anyone else have any questions they want to put in the chat, or, oh, Hetty did type something in here. It looks like, do you have clinicians who speak Spanish? That's a great question. So if you do a search in your area, we do have a place in our clinicians account that they can indicate what languages they speak. So you can look at the clinicians that are in your area and then look and see if there's any that do speak Spanish. I will say that we do have the treatment materials, the exercise sheets, the resources we would give you in therapy. We do have available in Spanish that your therapist can download and print, and so that your written handouts are in that language. We actually have them in quite a few languages. But if you're looking for a clinician that speaks Spanish, you can look on our website and look in your area. Good. Anyone else with any questions? Okay. We had one thank you. You're welcome.
Hello.
Good.
Hi.
Hello.
Hi. I'm wondering, I've just barely been, in fact, I haven't been told that I have a definite case of this, but my voice has always been quiet. And I've had 2 sessions, and that's all I was planning on doing. Is that the sort of thing to do? Just do my practice things there, use the helps you said here, and wait to really get into a serious class?
Yeah, so Donna, that's a really great question. And so what we would say to LSVT LOUD certified clinicians is that we want to take clients as soon as they're diagnosed. Because even though you're not noticing, as many changes yet, if we can get you in before you have noticed those and before those deficits have set in, then we can give you those tools to help you maintain where you are now. And it's easier to do that rather than having you go so far down and then it's harder to bring you back up to where you were before. So we always recommend, the earlier you get in, the better. And there's ways that your therapist would work with you to keep it challenging. So maybe you can, have a good loud voice in a certain situation, but what if we add, a cognitive or a motor task with that? Can you keep your voice loud while you're, dealing cards or knitting or whatever it might be that you like to do, so that we can make sure that you can still use your good loud voice in all the situations where you like to use it, as opposed to getting to a point where, oh, I don't like to go to those meetings anymore because no one understands me. And so we want to keep you where you are and even improve you and just make sure that we can give you the tools you need to maintain where you are. I had another thought with that. But the main thing is definitely, the earlier the better. And that's what we would recommend to everybody, whether it's for LSVT LOUD or LSVT BIG. I remembered my thought. We do get comments like you mentioned where you said you've always been a soft speaker or always been a soft talker. But a question then I would ask is, well, have others, always asked to repeat, or have others always leaned in to hear you? And sometimes that's just, kind of the light bulb that goes off like, oh, it has been more recent that I'm, having trouble being part of the conversation, or I'm being asked to repeat more. So even if you've always been a soft talker, maybe before it was easier to understand you, and now those deficits have set in a little more. So that can be another thing to think about too. So yeah, I would recommend getting in as soon as you can to maintain where you are before it's, harder to bring you back up to that level.
Thank you.
Yeah, thank you.
Great, Donna. Thanks for the great question. We did have another one pop into the chat from Bobby, which was, which program should you start with, BIG or LOUD? And that is a great question too. As a treating clinician, And people would ask me that question, I would say, well, you can do both at the same time. So you can go in, and do 2 hours of therapy in a day, 1 hour with your physical or occupational therapist and 1 hour with your speech therapist, and do both programs during the same month of time. It is, double the time in the clinic. It's double the exercises at home. It's all of that. But for some people where transportation's an issue, or they just want to get it all done with and get it out of the way, a lot of my patients would opt to do both at the same time. If both is too much to try and do right now, then usually what I would say to my patients is, what do you think your biggest barrier is right now? Is it your voice? Is it people hearing you? Or is it your movement and you're concerned about your movement patterns? Whichever one you feel like is impacting your life at this time the most would be the one that I would recommend starting with. And then you can always, transition into the other one after you're done with whichever one you chose. Good. Perfect. We had another thank you in the chat for sharing information. You're welcome. We love doing this. This is one of our favorite things to do. And that is all I see for questions. Anyone else with any other questions before we sign off? Okay. We answered them all. Look at that.
Yep. And
Thank
always feel free to email us if you think of things later. We're happy to address them that way too. So thank you all for joining us. Thank you, Jenny, for the great lecture and responses here today. And we hope to see you guys on another webinar.
Goodbye. Thank you.
Bye.
Thank you.